The connection between housing and healthcare cannot be more direct. Housing is health. If an individual is not housed, they will not be healthy, period. We think about healthcare. We think about going to the doctor, like my arm is broken, right? Or I have the flu. But they don't think about when their housing is broken, right? Or food, access to food or green space. These are all indicators of a person's ability to be healthy. And housing is one of the highest indicators.
When it comes to homelessness, here in California, half of the homeless are homeless because they're economically homeless. They just cannot afford a home. Now, the other half of folks who are homeless have other issues that they're having to deal with. They may be living with a chronic mental illness. They may have an addiction. We don't always know what came first, but we know that there's more services needed to assist them.
I mean, there's so many different things that happen here that provide help and hope for people like me. If you want to use the resources, there are so many available. And, I got 10 months clean and sober off of that.
At the end of the day, if we're addressing all the factors in a person's life and they can get all those factors addressed in the same place or the same location or through the same effort, will ultimately going to impact their health in a larger degree. What would happen if we were to include the food sector into what already exists? What would happen if we were to include the educational sector?
Would it be possible to construct a new city hall adjacent to affordable housing, and those could complement each other? This is a creative way to improve your public spaces while providing housing to people that otherwise wouldn't necessarily be able to afford it.
The more people that didn't realize that permanent supportive housing could look like that, one at a time, we start to change perspectives. That becomes better for that community. It becomes better for the members that are living there. And it also becomes better for the healthcare system because, quite honestly, it's cost effective for our members to remain housed. So it's not just a win-win, it's a win-win-win if we're able to do it.